Good morning. Good morning, colleagues and distinguished delegates. Thank you so much for being here with us today. Those who are in the room taking a break from very difficult negotiations that are going on, and very important negotiation, but also finding a room that maybe is not the easiest one to find, and those joining us online, as well as some dear colleagues. It is my honor to be your moderator today. My name is Giovanna Campello. I am the chief of the Prevention, Treatment and Rehabilitation section. And what we would like to do today is to update you on our initiative on prevention, children amplified prevention services that we abbreviate in CHAMPS. And with this, I would like to give the floor to my director, Mr. Jean-Luc Lemayeux, the director of the Division for Policy Affairs, to open up this discussion. Please, the floor is yours, Jean-Luc.
Thank you very much, Giovanna. Thank you very much as well for being here with us in this big room, the conference room number 1. I know that many are already connected as well by internet. So for those who are not in the room, also warmly welcome wherever you might be, wherever the times as well in your place of location where you connected to us, very much welcome. Needless to say, I mean, that this program, CHAMPS, is something which is very close to my heart. And it's close to my heart because as a practitioner in the field, having spent most of my career indeed in different assignments abroad, I do know how precarious it is, I mean, to try to risk or to limit the risk which the most vulnerable in many populations, segments of the populations, do occur, do have any day. And I can tell you that the situation which I have witnessed in some of those continents abroad is very different from one place to the other. I mean, locations do shape different parameters, do shape different vulnerabilities, do shape a different context to which we need to devise indeed different solutions. I know that you all have been extremely busy in recent days with the outcome document and the other discussions in the Commission on Narcotic Drugs. I know, I mean, how difficult it is. It's a very complex situation. It's a fascinating topic, no doubt. There's quite some frustration around as well. I mean, if you look at the data which you find in the World Drug Report 2023, you will see indeed, I mean, that when it comes to demand, when it comes to supply, when it comes to manufacturing, when it comes to production, I mean, that you see an increase, that we are thinking about what we can do better and how we can do it better to ensure, I mean, that we get more control on the situation for the public health benefit of the population we are working for. Now, that is very important. And I can tell you, when I worked in the Caribbean, then at that moment, we saw very much how supply was creating demand. And when I was working in other parts, I mean, how demand was creating supply. It is really such a complexity that we need to have an approach where we push different buttons at the same time. It needs to be a balanced approach. It needs to be something which is really well thought through. Now, one element which is somewhat overlooked is indeed how we can ensure that young people, I mean, from early childhood onwards, until the age that they are becoming adolescents and moving forward, build more resilience to avoid that they get in risk situations, to avoid that they get in harmful situations. And I think that's really what CHAMPS is aiming for. It is trying indeed to revamp, to make clear, I mean, that we need to push that button harder in ensuring that youngsters are fully aware about the context in which they live, are fully aware as well about the opportunities and the challenges they will face as youngsters throughout their young lives, and in how we can build in resilience so that they don't find themselves in those situations which then ultimately might result in harm to them, to themselves and their communities. So that's really what CHAMPS is about. I mean, that's what the entire prevention taught us about. And we do hope, I mean, from your end here, available in the room, that you can support this thinking within the balanced approach. I mean, there's a lot more required than only prevention. We need to have a balanced approach, but within that balanced approach, to put that emphasis on prevention, I mean, very strongly forward. So I do hope indeed, I mean, between now and the coming weeks running up to the CND, that we can count on you, when discussing the different documents within the CND, the different resolutions within the CND, the different discussions we will have before the CND, that we put that element of the prevention, building resilience among the youth, I mean, very, very strongly forward. From our end, I can tell you, I mean, we in the Division of Policy Analysis, we as well within UNODC at large, and spoke with the Executive Director in detail on the same, I mean, very recently, we've very much tried to push that forward. There's another element in this, and this is, I would call it a little bit more the mandate of the United Nations of trying to build bridges in a polarized world. The policy discussion is not always an easy one, as we all do know. And there are different schools of thoughts. But as the United Nations, we think that nobody can deny that in whatever situation you stand for, whatever ideology you try to move forward for, that we need to protect the children. And I guess, I mean, that is not a motive for us as United Nations trying to move this forward in ensuring indeed that within all the political debate which we do have on policy and drug discussions, that we do have as well a kind of a comprehensive consensus where we can come together. Somebody doesn't like the consensus, okay? That we can move that consensus forward together with you. So that is an element which I think, I mean, for us as the United Nations is as important as the other ones. I'll leave it up to there. And moderator, I give the floor back. Thank you very much.
Thank you very much, Jean-Luc, for framing our dialogue and discussion today, and especially reminding us about the ultimate goal of all of our work, which is the health and well-being of the people of the world, and already opening up some ideas and issues which touch upon the the topic of the next presentation. And in this, I have the honor to introduce Justice Teti, who leads the branch that works at all of our drugs mandate, the Drugs Laboratory and Scientific Services branch, to tell us a little bit more in depth about the political commitments and the role, of course, to CND as our main international policy-making body. Justice, the floor is yours.
Thank you very much, Giovanna, and a warm welcome to all of you. I know it's a very busy Monday morning, so we're grateful you've been able to squeeze a little bit of time from the informals to join this briefing. Colleagues, the science tells us that when it comes to initiation of drug use, children are probably the most vulnerable. It also tells us that they are the most vulnerable when it comes to the harmful consequences of drug use. And why do we experience that? It's because between the ages of 0 to 25, the human brain is still developing. And the last thing you want to do is to alter its natural course. And evidence also shows that the earlier children start to use substances, the more likely they are to develop mental health disorders, including substance use disorders. Now, when you look at the Convention on the Rights of the Child, it recognizes how important this is. And in its Article 33, it calls on us to adopt all necessary measures to protect children from the illicit use of drugs and psychotropic substances. Jean-Luc also made a very good point on the current policy environment. It doesn't matter what ideological angle you lean towards. Everyone agrees that we've got to do something about children. We need to prevent drug use in children. But where are we when it comes to drug use globally? The World Drug Report tells us that drug use is going up. Scarily, it tells us that among children, the perception of risk when it comes to drug use is going down. The 2022 report also says that the age group most at risk of using drugs, that's 15 to 34, is projected to grow in the next decade, especially in low-income countries. So you see that trajectory we're taking. Drug use is going up, reduced risk, perception of risk, and the population we worry about most is going to grow double within the next decade. But there's good news if this works. It does. We know that prevention works. There's a lot of science behind it. And the UNODC, WHO standards of prevention tells us everything we need to know. In 2023, at the CND, you took the step of acknowledging that children are at very high risk of the consequences of exposure to drugs. Importantly, you also made a point that these children need to develop within healthy and secure family and social environments. Colleagues, as we approach the midterm review, this is a time to make it happen. Now, unlike enforcement work, which can yield results within a very short time, with prevention, it takes time. The science tells us you need to invest, you need to be patient, and you're looking at a span of 5 years or more to see actual results. My simple arithmetic tells me 2024 plus 5, very timely. It takes us to the end of the 2019 declaration. And plus 5 also gets us very close to the reporting time for the 2030 agenda. So colleagues, this is a time to make it happen. How can we do that? You've all led on the Chair's Pledge for Action initiative. I will encourage you as we get to the CND to take advantage of this initiative, especially the challenge, which refers to, and I quote, the abuse of narcotic drugs and psychotropic substances have reached record levels. How can we do this? You could perhaps pledge to invest in evidence-based programs on the prevention of drug use in children over the next 5 years. Focus on schools, focus on youth, focus on family centers. And what we can achieve by doing this is try to address the vulnerabilities and also alter the development path for these children. Eventually, we want to have these children growing into healthy adults and citizens of tomorrow. Remember, the World Drug Report has warned us, but we have the chance, and we can take that choice to alter the trajectory. We're going to share the slides with you in case you need some guidance on how to pledge. And there are extra pages in the slides which will give you examples. Briefly going through it, you could pledge to collect data on drug use situation amongst children over the next 5 years in your country. Easy again. You can pledge to undertake rigorous monitoring and evaluation of evidence-based interventions and policies. You can pledge to intensify your work with civil society organizations dedicated to the prevention of drug use. But what I would like most is for you to pledge to support the UNODC CHAMPS initiative. And you can do that politically, as you've been doing, or go further and support it financially. Thank you.
Thank you, Justice, and thank you for giving us very concrete possibilities to promote evidence-based prevention, early prevention, and ultimately CHAMPS. And from here, I would like to move to from something that is very much in all our collective mind, because CND is in less than 1 month, to think together a little bit more how will CHAMPS look like in practice. So many of you had the possibility and the opportunity to come at our first briefing for member states on the 30th of October, and we thank you for making time for being with us at that time. Not everybody was managed, so we will give you a tiny bit of a recap. But in the meantime, there have been many things that have been happening. We have been talking with many colleagues, many of representatives from the permanent missions and from capitals. And so we can give you a bit of a better idea of where we stand and where we want to move in practice after CND. And to do this, I would like to give the floor to the person that is coordinating all of this work, the program of work on prevention, but specifically also CHAMPS in the prevention, treatment, and rehabilitation section, Wadi Malouf. He's next to me, and I'm very, very happy to give him the floor. Please, Wadi.
Thank you, Giovanna, and I also take the chance to recognize everyone's presence here in terms of the efforts done on prevention, the interest in prevention, and the follow-up on the prevention, particularly when it comes to the science of prevention and early prevention, but also I recognize the the guidance and support of moving all the way from our executive director, Jean-Luc, Justice Giovanna, for this purpose, and the entire team working on this. So what I'm going to present is more collective thoughts in terms of how we see CHAMPS materializing based on the political commitment that has been generated either through our field work in terms of operation or through your own political interest in terms of member states engaging within the Commission. So CHAMPS. We had a briefing before, by the way, on this for those who have not attended, but I'll try to rebrief you a bit on what it is, but the previous briefing is available online for your own review as well. So I'll try some buzzwords first to kind of orient ourselves moving forward. The point of focus that we're talking about, like we do in our prevention standards, the point of focus is not the drug. While we are working on drug prevention, the point of focus is the person. And in that context, we're talking about children. Drugs is secondary in this, but it is a prime component in terms of vulnerability that are being addressed. These are vulnerabilities in line with the prevention standards that focus on, if addressed, reduce the chance of engaging in a risky behavior that is substance use, drugs, whatever is accessible, drugs being under international control, or substances that are psychoactive in general, even those that are not under international control, but also vulnerability that goes beyond drugs. We're talking about development of children, accompanying them in different ages of development. We're talking about building resilience, but we're also talking about, by doing so, applying science in terms of in moving forward. But everything that has been done so far in most countries have been interventions that are at best in line with science. But what we're looking for now is more a systematic approach, moving things to scale, bringing several interventions together in line with the science at different ages of development, addressing different vulnerabilities that the children might have, whether any child, whether children living in higher risk than others or indicated, but also a better coordination between the different partners that are applying the prevention response. So the amplification will be in the size and scope of the services, but also by the better coordination and application of science between the counterpart as a system. That coordination is a key component that kind of differentiates the previous mode of work to what CHAMPS is. And that partnership not only within the country, between governmental, academic institutions and beyond, but partnership between also different international stakeholders that are applying the response. And this leads to the amplification component that we're talking about. And hopefully by doing so, the aim is to document effectiveness in preventing drug use, but also going beyond when it comes to cost, return on investment, and moving forward. So that's CHAMPS, and that's why we refer to it as Children Amplified Prevention Services. So we're looking for model countries to demonstrate these systems, but demonstrating it at scale, but within a specific geographical place, within the country. So when we say CHAMPS model, we don't necessarily mean the whole country will be a CHAMPS model country, but a specific geographical location where all children, by the way, we're talking about less than 18, would receive services from that system in place. Reflecting within a scope of 5 years of implementation, effectiveness, cost effectiveness, and return on investment of the work. This is where we're trying to shift the paradigm of work and then reflecting that shift of paradigm that's focusing on the persons and their development, the children and their development, making a return on investment beyond just preventing drug use. And by the way, there is a component where there is the research that we have within the prevention standards reflect whatever is available from the scientific review of the usual suspects, let's say, of countries where scientific research is done. But we know of many promising interventions in many countries that have not been documented, and that will be an opportunity to bring these experiences to light through the implementation of CHAMPS. So this is CHAMPS in a nutshell. Different ages of development, documented by different milestones of development. By the way, on your tables, you will have a detailed brochure on this and a leaflet also describing it in brief. But every single milestone of development, you will see we're looking to see a minimum set of intervention. You will see 3 lines, a green line for universal, all children within that age group, a yellow line, selective intervention for the population at higher risk than the normal population, and a red line, these are indicated intervention for symptomatic children that need to be addressed before it moves to a higher level of risk. And in every single age of development and in every single level of risk, there's a minimum set of intervention that need to be put in place. What we are proposing is in line with the standard, but it is important to note that this is not an imported model to come to your country. It will start by a review of the prevention system that exists in your country, mapping out whatever exists within the geographical region that is selected. Everything that is in line with the standard need to be improved to align it with the standards, promising, supportive to the structure in order to set up the system together. That will be the first year. And the 5 years to follow that will be a 5 year of implementation of this system, where your own academic institutions as well will be equipped to monitor and evaluate, because over 5 years, you will see the population that's 18 will be 23, meaning we have a chunk of the population moving to the risk where substance use is initiated, and there will be a documentation on substance use prevention. But for younger generations, you will see an improvement on other needles and indicators of improvement in their development, maybe mental health, violence against children, education attainment, and beyond. And this is an opportunity really to capitalize on the infrastructures that the country have and really orient their investment more aligned with science to have a better return on that investment moving forward, and really model in your country systems that can be replicated in other places within your country, but also you becoming a model country to sort of orient others and invite others to follow suit. So partnership is the key component of this amplification beyond the science of the interventions per se. The public sector, the private sector, the academic sector, the civil society, the interagency, it's merging of efforts that is a core component of this amplification that we're looking for. So in terms of national commitment, the main part of this is what do we need in terms of to become a CHAMPS country? A geographical location where all children within this geographical location less than 18 benefit from the system. And UNODC will engage with you in order to align the decision making and the fund allocation within that system in accordance with the prevention standards. That's a key sort of openness in terms of an engagement. The second point is providing technical assistance for the implementation within your own region that is specified on the CHAMPS model. But also a collaboration between specific academic institutions that you have for monitoring and evaluation purposes, and agreement on the indicators to follow forward. With that general agreement between us, the implementation of CHAMPS will be over a 1+5 year, one being a setup period and a 5-year implementation period. And there needs to be a commitment for a multi-sectoral collaboration and a coordination mechanism at least within geographical zone where CHAMPS is going to be implemented, and also a commitment to share that knowledge. That knowledge will be, as it progresses, it could be at the level of the prevention of substance use, it could be at the level of return on investment in terms of other indicators of implementation, and this reporting back could be within CND and beyond in terms of moving forward because we are looking for model implementation. So UNODC in this perspective will also be engaged with you when it comes to the country that are interested to implement in terms of mapping, orienting the services, setting up this model system together. We have the tools to support you to this effect, the review of the prevention system being one, but the prevention standard being more the broader aspect of what needs to be put in place. We will establish a technical desk within UNODC supporting your model implementation. That technical desk will be close to your geographical region of implementation of the CHAMPS model. We will be providing guidance and consultation during the implementation of the model, not only for the setup, but also during the implementation of the CHAMPS framework. And that guidance will be from the direct technical desk that's dealing with the prevention of drug use, but also would expand to other technical desks within UNODC that has symbiotic collaborative input to the CHAMPS model, may be the violence against children, where we have a strong strategy on violence against children that addresses the vulnerability of adverse childhood experiences that will be linked to substance use and beyond, but also from crime prevention and the like. So we're looking at waves of implementation. So it's not like the commitment is going to be for those that say yes now are in, and those that are no, but there will be waves, multiple waves. We welcome as early as possible an engagement of waves, as our Chief of Branch mentioned, Justice. The earlier we can start, the more we have models that can be reporting back to the Commission by 2029. And this would be a key for the next political declaration on one end. And on the other end, it's kind of also timely within the SDG implementation of 2030. So the first 10 are key, the first wave, but we also welcome more and more waves moving in. And we're looking for a 5-year implementation, but we're counting at scale in terms of the number of children that will benefit from this process. So that's in a nutshell what CHAMPS is about. And I will end with a small, brief sort of snapshot that sort of summarizes what we're looking for, but also it will end with a QR code where you can get more details about this. That's not. This QR code could take you directly to a web page dedicated with more resources to this effect. And Giovanna, the floor is back to you.
Thank you so much, Wadia. And maybe we leave the QR code while we start our discussion so that colleagues can take a picture at leisure, but also remember that we will circulate these slides. So it's not that if you don't manage to take a picture, it's lost. It will be circulated to everybody. And anyway, everything will be on our website. It's not so difficult to navigate. So thank you so much, Wadia, for giving us a better sense of what will happen in terms of CHAMPS once we start working with the countries that have that will accept and will commit to work with us, at least in some part of their country. And with this, I think we have exhausted the information that we want to bring to you. And I would like to open the floor for any questions or comments that you might have. This is a dialogue, so we have purposely tried to keep the presentation to a minimum. Of course, anyway, there is a minimum information that we need to provide to you, but now we have ample time to listen to you and maybe clarify whatever thoughts or doubts you might have. the floor is open, and we might have also colleagues online that want to request, but let's start. Slovenia, I don't see you at all. Oh, sorry, you're kind of hiding behind the European Union. Please forgive me. Distinguished delegate of Slovenia, the floor is yours.
Thank you very much, and good morning to all. And first of all, I would like to thank the UNODC for this second briefing of the CHAMPS initiative that Slovenia greatly supports. As we've heard also today and on other occasions, that the CHAMPS initiative aims to build a comprehensive framework for member states to implement evidence-based prevention programs, fostering healthier society and reducing the burden on public resources over time. Slovenia believes that addressing the world drug problem requires a collaborative and sustained effort from all UN member states. By endorsing the CHAMPS initiative and pledge for prevention, especially early prevention, we can work together to create a global environment that fosters resilience, promotes well-being, and empowers individuals to lead drug-free lives, ensuring a safer and healthier future for generations to come. With this, I would also like to invite everybody to the high-level side event titled Evidence-Based Early Prevention as a Core Human Rights-Focused Investment Needed to Reduce the Risks of Public Health and Safety Posed by Drugs, hosted by Slovenian Minister of Health, together with the UNODC, Norway, Vienna NGO Committee, and Institute Utrip, which will take place on the 15th of March this year. So thank you.
Thank you, distinguished delegate from Slovenia. And let me add on behalf of UNODC, how grateful we are to the work of Slovenia that was first the one that picked up the baton and said, yes, let us try to have a dialogue in the Commission of Narcotic Drugs on the importance of early prevention according to the standards. And of course, to all of you delegates that endorsed that wonderful resolution, that was an amazing step forward in our international commitment around prevention. And now sponsoring a high-level event, which I hope will put early prevention and CHAMPS on the international map and really keep that visibility of that work very, very highlighted. Any other comments or questions? Don't be shy. Do we have anything online? Yes. Pardon, Russian Federation. Please, you have the floor.
Thank you, Giovanna. First and foremost, I would like to express our gratitude both to providing the second presentation on the CHAMPS and for keeping member states updated, but also for all your efforts in terms of comprehensive demand reduction initiatives, including this new, very promising and ambitious initiative on prevention. We believe that prevention requires more efforts and more attention, both from the side of the UNODC and international community. And unfortunately, during the current negotiations of the midterm review outcome document, this topic is a bit overshadowed, but we hope that at the very end, there will be also a strong message on prevention with a particular focus on children and youth in the outcome document of the C&D high-level segment. It is important that the launch of CHAMPS coincides with the midterm review and the first results may be visible till 2029, so that Commission has more data and more successful examples on how prevention works. And we hope that this topic also will be further elaborated and strengthened during the the 2029 full-fledged review. So this is something from the policy perspective. From the practical perspective, I would like to ask you what is the criteria for selecting countries which will be covered by the first wave. Surely, in our understanding, the most important prerequisite is the political will of the country to participate in this exercise. But at the same time, the question is, how are you going to ensure balanced geographic representation and whether a volunteering country, let's call it like this, a volunteer needs to have some basic elements of prevention system, or it can be built from the zero level, and whether you are going to cover countries with different potential and existing infrastructure in terms of prevention. So it would be interesting to know what's the vision of the office and the main criteria in terms of selection of these volunteers. And I wish you good luck in this important endeavor. I'm pretty sure that with this very elaborated and tailor-made model which covers different ages and different risk factors and circumstances, the UNODC in partnership with member states and relevant UN entities will succeed and will bring prevention to a new level. Thank you.
Thank you very much for these encouraging words. Distinguished delegate of the Russian Federation. I will pick up on one word in which you mentioned. Thank you for updating us. I was toying with the idea, and we've never really discussed with the idea of creating friends of this kind of groups in support of specific ideas. I am more in favor of doing this kind of updating because it's just more inclusive. It's just open to everybody and is open to hearing the concerns and views of everybody. And we definitely intend to update you at regular intervals going forward. So that was a small comment on your intervention. And with regard to policy, of course, the policy discussions are very much in your hands as representatives of our governing body, and that is why the intervention of my dear boss, Justice, really focused on what you can do beyond that and what we feel we can recommend to you in terms of keeping up the profile of prevention also beyond your very important discussion, in which we hope you will keep on the visibility of prevention very high, but of course it's your prerogative to discuss. Having said that, I would like to give the floor to Wadia to respond a bit more in detail with regard to the selection criteria, so to speak. For us, of course, the most important is the geographical balance, and but then beyond that, there are also some practical consideration. So I leave you the floor, and then I acknowledge Egypt and Austria at least to intervene afterwards, please.
Thank you, Giovanna. And I also appreciate the question from the Russian Federation and general support for the prevention component in general. With regards to the list of countries, as you mentioned, it is a list of countries that will volunteer in terms of moving forward. But within that scope of countries, we have two groups. First of all, the importance, of course, there's a commitment in terms of implementation of that system over 5 years. So, for example, the presence of a strategy, particularly a funded strategy in terms of implementation of, let's say, a drug strategy where there's a prevention component that's funded, because there's a component of the system by itself being funded. That's a key component in terms of implementation, that there is a model that could be funded. And that's, I think, the majority of the cost. The remaining of the minority related to the cost is that cost of technical assistance. Some countries do have an international collaboration budget that they can work and engage with UNODC. And this will allow us to have an infrastructure mobilized to support you in this implementation. But we also appreciate that there are a group of countries that do not have funds for international collaboration. And this is where we're looking in terms of what Giovanna has referred to in terms of supportive member states that are interested in CHAMPS as an idea, as an initiative, where some technical support can be availed for UNODC to assist these countries interested to implement a CHAMPS model, but do not have the funds for technical collaboration globally. So these are the main key ingredients. But also, of course, in the background, we're looking within this context to have as much diversification as possible in terms of geographical implementation of this model, so that it doesn't get tainted that prevention is only in, for countries that have high resources, that have this profile of implementation. The more demonstrative models that we have, geographical diversity and political diversity in terms of challenges faced, the better. But these are the general parameters that we are looking for.
Thank you, Wadia. I would like to give the floor to the distinguished delegate of Egypt, please.
Thank you. And I would like to thank you all for this presentation. And I commend the UNODC effort to launch this unique initiative. As you are aware, that Egypt, one of the first countries that has volunteered to be part of this inclusive and unique initiative, because this initiative aims to prevent the use of drugs and other psychoactive substances from childhood and adolescence. And as you are aware, in Egypt, the age group most vulnerable to drug abuse is between 15 and 25 years old, and we are, as one of countries that we have, our population is full of youth, so it's very important to have these prevention measures. And the age groups most likely to seek treatment is between 25 and 35 years old. So the more we tackle this issue earlier, the more we will have a decrease, or it will happen our demand in our demand reduction strategy, because we think in Egypt that preventative measures are one of the main elements of the demand reduction strategy, particularly when it is effectively implemented to target early stages to decrease drug abuse among children and youth. So Egypt has developed a comprehensive range of preventative measures programs, which focused on establishing networks of youth volunteers throughout all Egypt governance, with a total of 33,000 members, and implemented a comprehensive awareness activities, outreach 10,000 schools, 25 universities, and 700 youth centers. Moreover, the Fund for Drug Control and Treatment of Addiction developed in the past few years life skills programs in cooperation also with the UNODC, enhanced the role of family in prevention and early detection in cooperation with 150 NGOs in 27 governments, and implemented a comprehensive preventative and treatment program in the newly developed urban areas, alternative to slums, which accomplished the following: trained 400 community leaders, conducted 200,000 home visits, door-to-door campaign, and established 10 community clinics that received 16,000 patients in 2023. Moreover, as you are aware, we have implemented broad awareness media campaign during the past 8 years, and which resulted in 180 million views. So, in conclusion, we're looking forward to cooperation with the UNODC, Romania, and also the Fund for Drug Control and Treatment of Addiction to see how we're going to implement this innovative and unique initiative in Egypt and see how this model can be successful and we can help in future to implement it in other countries and other areas. I thank you.
I thank you very much, distinguished delegate of Egypt, on many, many accounts. If I could be informal, my response would be, I can't wait to start. Given my institutional role today, I just would like to thank you on behalf of the of UNODC and for having and the government of Egypt for having volunteered, and we are in concrete discussions of how to really move this forward, looking at the location, looking at how to support technically and starting as soon as possible. So, and all of the amazing things that already you mentioned, and this is just for everybody, of course, they will not be lost. We will build on what has already been done, looking critically, is it in line with the standard? Can we improve it for the benefit of children and youth? Thank you very much. I would like to now give the floor to the distinguished delegate of Austria, and I acknowledge El Salvador afterwards.
Thank you. We would also like to join our colleagues in commending UNODC for this very important initiative. And for Austria, early prevention is at the core of our health-based approach. We have a practical question that follows up to what has just been said. So for one, what is the timeline for these different waves in case a country we have recommended this initiative to our ministries, especially the Ministry of Health. So we would be curious at what stages one could join, what are these waves? And equally, we would be interested what a country like Austria, where we have prevention in schools, in kindergarten, at every stage almost of education, how we could practically join the CHAMPS initiative, additionally to potential funds. Thank you.
Let me take this quickly, maybe. Thank you very much for your kind words and a very, very practical question. In terms of waves, just come and talk to us as soon as you feel that you want to explore this more in concrete. In theory, we are looking at the waves now and we will start next year. This is our vision. At the same time, we might not manage, or we might manage to start with 5, and we wouldn't close the door on additional countries. So there is no firm deadline. And moving on to your more practical question in terms of how could Austria join? We could have a dialogue with the authorities that are in charge of prevention first. We might need to have a dialogue also with other relevant authorities, because of course prevention's links to many, many different sectors. And the idea would be that we would select a part of the country where we would like to see, okay, given that all of these services already exist, let's look at them and in the light of the standards and see how they can be improved. And then we would, on that basis, set up a plan to improve together to improve those services and to document the effectiveness of this initiative, so that at the end we can really say, by doing this, we have made a difference. And that is also partly in response to the question of the distinguished delegate from the Russian Federation. There is a lot of inbuilt flexibility in the model, so that it can be implemented in countries that have very strong structures, and in like Austria, for example, or very strong services already being implemented, and in countries where things might need to be built more from a basic package. Jean-Luc, did you want to come in, please?
Yeah, just very fast. When we say improve, it is well improving ourselves.
Oh, yeah.
So it goes in two directions. So, I mean, if Austria has that layers of prevention programs in place, we would love to see as a partner, because we can learn as well, I mean, from how that is being implemented and what the research and what the science is telling you about success rates. I mean, how we can take that back with us and see how we could eventually replicate that in different contexts, if that would be feasible. Something which we have done recently with Norway as well, where we had a good interaction with regard to prevention, demand reduction, and an excellent discussion on what we can take from you, what we can tell you as well, I mean, which is eventually helpful. So it's a two-way street. So whatever level you are, I mean, you're very much welcomed in being a partner in CHAMPS, because it will benefit us, and we hope it will benefit you as well in being part of that larger framework.
Thank you so much, Jean-Luc. Distinguished Delegate of El Salvador, please, the floor is very much yours.
Yeah. Thank you very much for this briefing. El Salvador also wants to commend UNODC for this initiative. As you know, El Salvador attach great importance to prevention. That's why we support and co-sponsor the resolution presented by Slovenia in the 75th CND. And I have a practical question about the countries, the 10 countries. If one country wants to be part of these 10 countries, how is the procedure to apply? You will send an invitation, or we have to approach to the UNODC and express the interest for that, and what is the deadline? Thank you.
Thank you very much, distinguished delegate from El Salvador, for the support and the very practical question. We are not very formal. So after this meeting, we can have a coffee, or you know where to find us. We recognize that because CHAMPS is based on a systems approach, it requires a very considerable and strong commitment from the country. So that will not happen from one day to the next. It will not happen just based on a letter, right? So we are in dialogue with many countries, and some countries have approached us and say, we are interested, but we are not sure. Can we talk a little bit more in depth? And so it's through these dialogues that then hopefully we will come very soon at a few countries saying yes, and that's where we will set up together an agreement on how to proceed further. But especially these initial expressions of interest, let us not be formal. You know where to find us. We are here at your complete disposal to talk and think together about how to present this initiative maybe to your national authorities. Maybe your national authorities are interested, but they're not so sure. Let's have a meeting even online so that we explain a little bit better and they can start thinking a bit more concretely how to go about it. So I hope I have given you the sense of how we are completely at your disposal. Thank you. Yes, please. What do you want to do?
Thank you, Giovanna. It's just a small component, because given that the process is still initially in terms of moving from an initiative to put it on the ground, it's still a bit not concrete in terms of how mode of action is, because it's also depend on your national way of engagement with international communities. But I can tell you from practical experience, we have received non-verbals from countries expressing interest. Egypt, for example, just mentioned that. And then this follow-up has been here at headquarters with regard to the permanent mission to see in terms of what kind of engagement, but also at the capital, because also our field offices are engaged with the capital to provide further details. And we're arranging also webinars or web-based communication to answer any questions, because the general idea in terms of the commitment being there and moving from that commitment to the actual implementation requires an engagement. So also we welcome engagement at the capital level, and we're happy both as the technical desk and our field officers to engage directly to answer any questions moving forward. So I think we can do it at Vienna and we do it in the field together, and I'm sure by this we can find the appropriate formula moving forward. And maybe, I don't know if Justice would like to re-emphasize the pledge for actions as well.
Yeah, thanks, Wadia. Colleagues, I believe it's both a political and moral priority for countries when it comes to protecting children. Over the next few weeks, you probably have the pen on the statement which your capitals are going to read out, or you'll be involved in the pledges which the countries are going to make. Please, the children in your country are counting on you. Pledge for early prevention and go as far as you can to pledge for CHAMPS. That's my message for you. Thanks.
Thank you, Justice. You just stole my closing words, but which is wonderful because I don't think I could have articulated them so clearly. But I would like to still look at the floor and see if there are any additional comments or questions that we can address right now. I'm checking my colleagues. There is nothing online. So having said that, let me thank you all for being here. No. Okay. There is somebody.
Giovanna, may I just submit a question? I mean, how
you have the floor.
Thank you very much, Giovanna. I mean, a question which I haven't heard is, and I guess it must be on your mind somewhere, somehow. I mean, if you roll it out at operational level, how do we work together within the wider United Nations system? And I can guarantee you, I mean, that we're working very hard on that as well. So to ensure that your Ministry of Health doesn't get 17 requests from 17 different UN entities with regard to programs on early prevention, on resilience to youngsters and so forth and so on. So I can guarantee you that, I mean, at the same token that we are trying to move the operational frameworks forward, that we have discussions within the wider UN family, I mean, to ensure that we find that partnerships and can strengthen the impact of the respective programs many of us in the UN might have. Thank you.
Thank you, Jean-Luc, for submitting the question and also the answer, which makes my job so much easy. Dear friends, with this, it's my great pleasure to thank you all for being here. Just by being here, you testify to your commitment and interest in early prevention and CHAMPS, and I thank you all for that. As Justice has just reminded us, please build on this commitment and make early prevention and CHAMPS visible during the upcoming CND. And do count on us to if you're interested, but even if you're not interested and you just want to discuss ideas and possible initiatives on early prevention, do count on us. We are at your disposal. This QR code, which we are leaving here and we will distribute, will bring you to our website, but also on our website, and we are very, very easy to find. And we will strive to support you in every way you can to promote early prevention and also in the context of CHAMPS. I thank you all. I wish you a good rest of the day, end of the week. It was a very nice way for us to start the week, and see you around very, very soon. Thank you.